83. Total number of unique patient tests, 26,120. Total number of repeated tests, 3,063. Total number of private sector tests, 10,832. Total number of samples tested positive at both public and private facilities, 3,930. Our total number of active cases as of now, 2,063. Total number of discharges from all public facilities, 839. Total number of deaths, unfortunately, 65. And once again, our deepest condolences to those 65 real families, because these are real people who have succumbed. Recovered community cases, 963. So that's a bit of good news there. Total number of patients in our step-down facilities, 130. Total number of positive patients hospitalized stands at 82. In Caura, we have 22, and Dr. Trotman will speak to that. At Caura, we have 55. 2 are in ICU, 5 are in HDU, and 48 are on the wards. Ambulatory, as the doctors will tell you. At AREMA, we have only 5 patients, 4 in ICU, and 1 patient who is on a ward. Our parallel healthcare system is currently at 28%. And where are we with our step-down facilities? At UWI Debe Penal Campus, we have 6 persons. UWI Canada Hall, where we are housing the police recruits, we have 52. UWI Freedom Hall, again being used for the police recruits, we have 72. Balandra, we have no one there. Brooklyn, no one there. Tacarigua, no one there. And Napa, no one there. So there's a total of 130 persons in our step-down facilities. In our other facilities, Chancellor, we have 15, Cascadia, 17, Home of Football, 17, Regent Star, 22, and Paria, none. Debe, we have 33, so that's a total of 104. So that's the clinical update for this morning, and I now hand you back to Candice Alcantara.
Thank you very much, Minister Dayal Singh. And we are ready to move forward with the rest of this morning's presentation, if Minister doesn't have any further opening remarks. So we move right now to Dr. Michelle Trotman, who will give an overview of the COVID-19 experience from the Caura Hospital perspective. Dr. Trotman?
Good morning. Good morning, Minister.
Good morning.
I'm Ms. Alcantara, members of the viewing public, my colleagues. It is my great pleasure to talk about the COVID-19 experience with Caura. I can have the first slide. I must show you a picture of Caura. Caura is a beautiful hospital. I say that to introduce and to begin to allay any fears. It is nestled in the northern range of Trinidad and Tobago. First designed as a hospital mainly for chest patients way back in 1945. And since then has expanded. One of the biggest expansions actually came later on when we added our isolation unit to deal with things like Ebola, SARS, and MERS. Since then we also, which was in 2014, since then we also added the palliative care unit, where we house patients who are at end of life and we support those patients. That area was chosen again because of the location and what Caura looks like and what it symbolizes. It's a relaxing type of atmosphere. As you know, the Caura River runs behind Caura. In addition to the palliative unit, we also have drug rehabilitative unit at the Caura Hospital. With the advent of the COVID experience, what we did is we built in infrastructure. And we built in that physical infrastructure to house COVID patients. So we actually added, I'm very proud of that, 4 additional wards. Each ward houses 24 beds, or can have the capacity for 24 patients. So that's a total of 96 additional beds. And we also use the isolation unit to house patients, and the isolation unit has a capacity for 4 beds. So with the COVID-19 experience, we have added the 96 beds plus the use of the 4 beds in the isolation unit. I know when people hear about Caura, they think about TB and a TB chest hospital. Yes, we house TB patients, but they are housed in a different area following their own infection control procedures. I'm glad I said infection control, because in building the infrastructure, we put in place what is now known commonly as hot and cold zones on the areas where we house COVID patients to separate those who are either actively with COVID disease or suspected with COVID disease. They are normally in what we call hot zones, separated from people, the caregivers and others who would be in what we call cold zones. So those areas were built into the COVID areas to assure that we have the correct infection control procedures. Apart from physically doing that, we added the staff. And the staff that was needed built around nurses, doctors, and I want to spend a little time to talk about the psychological build-up that we did. Because we know that there's a bit of anxiety, apprehension around COVID-19. It's a new disease internationally, far less for us on the local national level. People don't know what they're getting into and they're anxious. Normally, if you come to the hospital, you're anxious. You're going because you're ill. You're not going because you're well. So it's not a happy place to be. So we want to try to make that more comfortable. And we know that one of the main stressors is that psychological element. So what we have done together with Professor Hutchinson and his group is built in a very strong psychological support, not only for patients at Caura, but really for the COVID program. But I'm speaking to Caura today. And that program involves a hotline where both patients and staff can access psychological services 24 hours a day. It is extremely important that we not only have this, but let people know what is available. The psychological unit has also extended services where they can come in one-on-one and meet with patients as they need to. In addition to that, we also have conferences where they would come into the hospital itself and also advise staff. So apart from the psychological services, we also have social services, because as you know, people come in and they may have social services problems that need to be dealt with. We've also broadened the physiotherapy aspect because patients may have chest problems requiring physiotherapy services and so on. But all of those names are big. Apart from that, we need the basic. People to cook, so we've supported that. People to clean, so we've supported that. People to take our patients from one area to the other, so we've supported that, what we call escorts or attendants. So we've built the infrastructure, and we've built also the human resource element of it. Pharmaceuticals have also been expanded to once where our service there was 3 days a week, to now where we have a 5-day-a-week service and on call 24 hours a day. So we've put these measures in place to handle the COVID experience. And I'm very comfortable with what we have to treat our patients with. Next slide. Let's talk a little bit about statistics. Since our first patient, and again, I'm proud to say that we at Caura actually were the first people. We received our first COVID-19 patient. And since then, till a couple of days ago, September 19th, I think is when the data is, we have housed a total of 636 patients. Of those, male to female proportion appears to be more or less the same, 52% males, about 43% females. Most of them adults, but we have housed children. Children under 16 are most times accompanied with their parent or guardian. We've had some non-nationals, about 3% of our total. The length of stay, I would like to touch on a bit. Length of stay has changed as the way we've handled COVID has changed. So initially we would keep patients until they were completely COVID negative. And as most of the population knows now, we are treating mild cases at home. So with that, most of our patients now stay 3 to 5 days. Some say 24 hours. So I would say the good news is, if you hear you're coming to Caura, you're coming to somewhere that's nestled in the hills, it's almost like a holiday experience, and you're not going to stay very long. Most of our patients that we take care of are mildly ill, moderately ill. So for that, it might be someone who requires some IV fluids. It might be someone who requires a bit of oxygen. It might be someone who requires antibiotics. Or it might be someone we just want to observe and make sure everything is okay until they settle down. So that is the type of patient that, generally speaking, somebody who's walking around, moving around, although we do have some bedbound patients, but for the most part, it's somebody who's moving around, walking around, mildly to moderately ill. Over the course of the COVID experience, we have housed at Caura patients who are more ill, ICU, HDU patients, but at this point, we do not. We house that more mild to moderately ill patient. So that's where statistics go. I want to say that, in conclusion, that COVID-19, unfortunately, will be with us for a while. We are asking at Caura and at all of the other institutions and nationally. And we try to get our staff to build that in while you're there. We try to get our staff to make a change in the person that's there, so that by the time you come in to the time you leave, we've made some sort of impression, amongst which we want to ensure that we emphasize that in COVID-19 now and for the very near and distant future, we need to do some basic things. Last slide. We need to get and all know and live the new normal. Most of the population is, but not everybody is doing it. And if we don't all sanitize, if we do not all socially distance, and if we do not all wear a mask properly, not just below our chin, then the few that don't have the ability to cause serious impacts, usually not on one or two, but on hundreds, if not thousands. And what is hurtful for me as a professional, medical professional, is often it doesn't happen to them. The things that are bad or deleterious or harmful doesn't happen to them. Happens to someone who wasn't looking for it in the first place. Somebody who may be at home, never moved out. Somebody who doesn't need it, who is immunocompromised, immunosuppressed, and who can't fight it off as you might have been able to. So again, I am pleading all of Trinidad and Tobago to please 3 basic rules that will be with us for now and the very near future and the distant future. To please sanitize, physically distance, and wear your mask. Thank you very much.
Thank you very much, Dr. Trotman. Our final presenter this morning is Nurse Renee Solomon, who will provide information on the role of nurses in reinforcing COVID-19 clinical guidelines and recommendations. We move to Nurse Solomon.
Thank you, Minister of Health, Mr. Terence Didal-Singh, Dr. Trotman, and Ms. Moderator Candice Alcantara. A pleasant good morning to citizens of Trinidad and Tobago. It's indeed a privilege to be here this morning to speak to you about COVID-19 and the role of a nurse in handling this pandemic in Trinidad and Tobago. First of all, I want to say COVID-19 is not a respect of age, race, gender, educational or financial status, or physical or mental ability. COVID-19 is here and has become everyone's business. This morning, I want to say to you as a nurse, as a frontline health worker, our role in this pandemic is very varied, but I want to touch on two major roles, which are health promoter and health educator. As a health promoter, our duty is to promote well-being and health, so that persons out there within my age group, I urge you please to adhere to the 3 steps that Dr. Trotman would have just mentioned: wear a mask, social distance, as well as sanitize. But however, there are persons within my age group who are also persons with diabetes, hypertension. I urge you, I encourage you, please take your medications as prescribed. Eat well, hydrate well, rest well. Of course, if you're not feeling well, don't go outside, don't go into workplaces. It's very important that when you come into hospital, you also adhere to the advice and instructions of the nurses. You know, sometimes you're out home and you may cheat on your diet. You know, as a hypertensive or high blood pressure, you need to, have a low salt diet. And then when you come into hospital, when we prescribe that diet, we get a lot of fight back. No, we need you to stick to what we are encouraging. I implore people to please encourage good behavior, good practice. For example, if you see someone out there who's not wearing a mask, whether it's a colleague, a friend, a family member, encourage them. Implore them to put on their mask. We sometimes take for granted that, you look well, that person look well and may not have the COVID-19, but we know that some persons are asymptomatic. I also implore persons to, in terms of education, the website is there, www.healthgov.tt, the Ministry of Health website. There's so many flyers around. Young people, I need you to act responsibly. Do what is right, do what is correct to promote good practice, good behavior. Another thing that I need to highlight as a health educator, persons who have been taking medications, don't let your medications run out. When it reached by maybe another 5-day supply, ensure that you get a refill of your prescription. We cannot afford to be complacent. We cannot afford to be laid back. This is something that is very serious. We, the nurses, the healthcare workers, need you to help us in order to help you recover those who have been hospitalized, as well as those who are outside there in the public. I implore you, a good attitude enables victory in defeating this pandemic. Thank you very much.
Thank you very much, Nurse Solomon, for those words of encouragement. And we move straight into the question and answer segment. Minister Dayal Singh, Dr. Trotman, and Nurse Solomon are of course here and available to answer questions from the media representatives, who are kindly reminded to indicate your name and the media house you represent before posing a maximum of 2 brief questions. This morning, our first questions will be posed by Guardian Media Limited.
Limited. Okay, so my 2 questions are actually to the Minister of Health and
Sure.
Dr. Trotman, if you could answer. So my first one is, I know that the Caura Hospital has a capacity of about 175 patients. And in the initial stages of preparations for the COVID-19 pandemic locally, it was stated that this hospital was going to be the centralized hub for treatment of COVID-19. So I'm wondering, why is it that now we have some in Caura, some patients in Arima, and some patients in Caura? So I just want a little bit more on the rationale behind splitting these patients up. And secondly, I don't think you all may have these statistics at hand right now, but I would like to find out how many patients exactly so far have died at home or within 24 hours of being accepted into hospital? Thank you.
Okay, so I will start off the question from policy perspective, and then Dr. Trotman will go into the technical aspects. So we stated from the beginning that we don't want our hospitals to be more than 75% occupied. As the disease progresses, we took a decision, as Dr. Trotman said, that Caura will be for those mild patients, and that Caura will be for more the moderate patients. We activated AREMA in the first instance for suspect cases, and we also have in AREMA, which I said many months ago, that AREMA will be mainly used, and it is being used for patients who need dialysis. So I hope that kind of answers, in a nutshell, the strategic intent, and then Dr. Trotman could go into the more technical details.
To echo what Minister Alleyne has said, the COVID-19, as you have seen this experience, we have to adapt, and we have to change along with whatever the needs are. So even though statements may have been made or the plan may have been down a particular road, we find that as things changed, we would have to make the system work best for us. So the main reasons for having that different characterization of patients at the different locations is because of the needs and where we think the needs would be suited most. Patients who are at AREMA mainly are patients who would need dialysis, or if for some reason where you become diagnosed as COVID positive, you may become too unstable to move from that place at that particular time. So that might be another reason why patients are housed in an area where we don't normally see them. Speaking to the actual number of deaths, I don't have those figures out front, but the number of patients who died at home are really very low. I pause because anybody who dies is a significant figure. I can't talk about a figure not being significant when it relates to deaths, but most deaths tend to occur in the hospital setting.
Thank you very much, Dr. Trotman. And we move next to 91.9, please.
Hi, good morning, Minister. Good morning to the panelists. For the next of all, 91.9 FM. Just two quick ones. We're looking at what Dr. Trotman spoke about with respect to Caura and the functions of Caura. Are there any plans in putting together a facility like Caura or another facility to be added that will deal specifically with infectious disease and things like the coronavirus, COVID, and so on? Are there any plans coming forward from the ministry to do that? And also going forward, the second question is, the pandemic has exposed some significant gaps in our health system in terms of being able to get testing done in a particular kind of fashion or getting results and that kind of thing. Could you tell us what else or what is currently being done to improve those particular applications at our health facilities? Because I'm sure you would have identified. And if you could identify some gaps too, you could tell us too.
Thank you, Vern. So we have identified Caura from day one as another facility for infectious diseases like COVID. So that has already been identified in addition to Caura. On the issue of testing, I can tell you two things. The testing backlog has been cleared up. What we are now clearing up is the reporting backlog. So we do have some reports to go out to persons via the offices of the county medical officers of health. So there are still some reports to go out, which we have identified from day one, and we are hoping to have all of that cleared off very soon. I met with the chief medical officer this morning on that. But as far as testing is now concerned, we are basically current with testing. Thank you very much.
Thank you very much. And now we move to AZP News, please. I think we have Mr. Bihari from AZP.
Hi, good morning. I'm not sure if you all are hearing me because I'm not hearing you. So I'll just go ahead and ask my question. My first question has to do with the recent liberal measures that the Minister of National Security has announced. Minister of Health, a lot of people in the United Kingdom are asking what is their status in terms of their country and how do they fall into this new measures and what do they do? And my second question has to do with statements being made in the UK by Lord Sumption, who is basically against stringent lockdown. And Trinidad and Tobago, we have had lockdown for about 6 weeks now. So I just wanted to find out if there's any thought to relaxing those lockdowns as the cases of COVID-19 seem to be always increasing.
Okay.
That's it. Thank you.
Thank you very much, Prior. So let us analyze the word lockdown. There is no lockdown in Trinidad and Tobago right now. There is none. People are free to move around. There is no state of emergency. There is no lockdown. There is no curtailment on people's civil liberties. The Constitution is up and running. Let me make that absolutely clear. So I just want to correct that statement. What we have are certain restrictions on certain activities that pose a challenge to the healthcare workers, that pose a challenge, as Dr. Trotman will go into. So we do have some restrictions on churches, on places of worship. We do have some restrictions on nurseries and preschools, but there is no lockdown. 2, the issue that you have raised, it's on the website of the Ministry of National Security, and I will invite you and any of the persons who contact you about the status of England and coming back to visit the Ministry of National Security's website.
Thank you, Minister. And we move to TTT, please. I'm not sure if we're being heard, but Ms. Wilson, you can go ahead and pose your questions. If you're hearing me, we will hear you.
Good morning.
Wonderful.
Are you hearing me now?
Yes, loud and clear.
Hi, my question is for the Health Minister.
Sure.
2 quick ones. Has there been any improvement in terms of cooperation from members of the public with respect to them sharing pertinent information for contact tracing? I know it was mentioned a few weeks ago that there were some issues regarding that. And also, for those who are home quarantined, any improvement with those patients who were not being so honest about whether or not they were experiencing symptom changes, whether or not their health was improving or otherwise? Those are the 2. Thank you.
Thank you very much, Crystal. Important questions. Dr. Hines will be here on Wednesday, and he will address that, but I think Dr. Michelle Trotman does have some information she can share with you.
So Dr. Hines and his team will expand a little bit more. I have to say that the public listens. All of the public does not always listen. That's human nature. We do need continued help with contact tracing. I think part of the impression is you have community spread. Why do you need to know? It is still important for us to do contact tracing. So we're still encouraging people when we reach out, the CMOHs and their support, when they reach out, that we get the information. I want to take the opportunity regarding people who are quarantining to also say that the reason that we didn't say that you can go out and yet already be a part of the regular society is because we still have some concerns. So I want to generally encourage that those people who have been sent home to quarantine for whatever reason, that you continue your quarantine period until you are advised by your healthcare giver that you should stop.
Thank you, Dr. Trotman. And I see that we have next I-95.5. I believe Mr. Turner is ready.
Yes, good morning to everyone. Whitfield Turner from I-95.5. I'm not sure who will answer my first question, but I'd just like to find out if any of our medical practitioners would have unfortunately contracted COVID and whether it would have progressed to the point of, unfortunately, of any deaths. And Minister Dial's thing I've been asked to ask, can pools be used for therapeutic purposes. For example, persons who have to do aquatherapy as part of their rehabilitative process for other injuries and so forth.
Thank
Can
you. So
that be used at the moment?
Yeah,
Thank
so
you.
I'll take the second question and then we go to Dr. Trotman. When we were writing these regulations, the advice from the Ministry of Health was that pools should be opened for aquatherapy. So if we look at the regulations, section 4.1a, and I'll read it out for you, on restriction of certain activities. For the purpose of controlling and preventing the spread, it shall be an offense during the period specified to be found in any beach, so it can't be found in a beach, bay, river, stream, pond, spring, or similar body of water, including the waters around any island off the coast of Trinidad and Tobago, or any public pool for recreational purposes. So, by definition, aquatherapy and physical therapy in pools is expressly allowed. That's a position we took when we were drafting the regulations, but I thank you for raising it, and it gives me the opportunity to clarify. I now turn over to Dr. Trotman.
Thank you. The medical healthcare professionals, first of all, I must say thank you to all of them at all levels for their contribution and dedication to the fight against COVID-19. Unfortunately, along the way, we have had some healthcare professionals who have contracted COVID. The source of COVID, as you could well imagine, is sometimes difficult to establish whether it would have come from the community itself or within the health environment. And it's one of the questions that we're trying to see if we can get some more information. But we do have some healthcare workers who have contracted COVID. Now, as you know, healthcare workers are not just doctors and nurses. So healthcare workers involve other people that support. So in terms of the absolute numbers, we would have to look at those figures in terms of nurses, doctors, and support staff to give you the absolute numbers for that. And we'd look into that for the future. As it relates to deaths concerning doctors and nurses, so far we have not had any deaths as far as I am aware, particularly for doctors. As you know, with the nurses is a bigger fraternity, and there are retired nurses, and so you know it can get quite technical. But as far as I know, there are no reported deaths in those categories. Yeah, but maybe Nurse Solomon can help us, and she is with us here. Nurse Solomon?
Hi. I agree with Dr. Trotman. We haven't had any reported deaths within the medical and health, nursing fraternity.
Okay, thank you very much, Nurse Solomon. And we move next to TV6. Good morning.
Morning, everyone. Urvashi from TV6. Minister, we saw that there has been updated guidance from the Centers for Disease Control, which suggests that the virus is airborne. I'm asking if the Ministry of Health has updated its guidance, and also are you considering it? My second question, on Saturday, there was a graph that was shown to us of the daily infections. It was, of course, interpreted to reflect that the infections were due to the last lap. But of course, we saw the Bar Owners Association, they interpreted the data quite differently, suggesting that the peak came pursuant to election-related events. Minister, I'd like you to comment on that. And if for the next conference, if we could get the date on which the police recruits were swabbed,
Sure.
we'd like that. Thank you
Sure.
very much.
So there were two peaks. One of the peaks that Dr. Hines mentioned was the peak in September, which was way after the election, and which seemed to coincide with that last lap in the weekend. That was way after the election. So let's deal with facts. So that is the fact. And then he also went on to demonstrate that maybe the legislation dealing with masks may seem to be having a positive effect. On the issue of airborne viruses, we have been seeing this very early, and yes, we are constantly updating our guidelines as to how people should conduct themselves, especially in closed environments. I don't know if Dr. Michelle Trotman again wants to comment on the technical component of airborne virus.
So certainly the updates on World Health site have been appreciated, and CMO will speak to that directly. But from the onset and through our battle with COVID, we have been using the appropriate measures to assume in circumstances where the virus could possibly become airborne, that we take full protection against that. So, as you know, you've heard this term, the PPE, which is for personal, shortened for personal protective equipment. In viruses that are airborne, we would adjust that PPE to make sure that we protect ourselves, and particularly environments that are enclosed, then we would do that with the PPE, and the specifics of that we could always work out on a different basis. So for now, we have been taking precautions. We will continue to take precautions to try to facilitate the best practice for patients and the medical staff.
Thank you, Dr. Trotman. And we move now to Express newspaper, please. Express, are you hearing us? Okay, if we're having any trouble with Express newspaper, then we probably will move to Newsday and come back to Express. So we go now to Newsday, please. Newsday, we're ready to accept your questions. Hi, Ms. Mackenzie from Newsday. We're ready for you. And as we wait on Ms. Mackenzie, just a reminder, everyone, we encourage you, as Dr. Trotman said this morning, please support the efforts of the Ministry of Health, the efforts of all of government, even your neighbors. Everyone is doing what they should. You do your part. Please follow the new normal. And we go back to Newsday at this point. Ms. Mackenzie, we're ready.
Hi, good morning, everyone. Good morning, Minister. Rihanna Mackenzie from Newsday here. My first question. PTSD workers are demanding thermoguns be used not only at the bus terminals, but en route for all passengers. Should testing be done, thermotesting, of course, be done on all public transportation platforms, maxis, taxis, buses? Is this something the ministry is looking into? My second question. Will the ministry consider revising COVID-19 strategies, looking at alternative strategies? This is in consideration of this case for Sweden, where they initially took a lot of heat for their approach to focus on at-risk groups, in particular elderly communities, but regulations were not as restrictive. Businesses remained open with social distancing protocols in place. And the latest figures suggest that the strategy is working. So is the ministry looking at alternative strategies in its approach to managing the virus? Thank you.
Thank you very much for those two questions. The Ministry of Health stands ready to support any agency with protocols, and we will work with PTSD if we are asked to. I would advise caution on how we deal with Sweden, and I would advise you to please research from reputable websites what Sweden is now facing. I continually say from these platforms we must compare apples with apples. I will not say what Sweden is now facing, but all is not well in Europe. That's all I will say at this point in time.
Okay, thank you very much. And we go now back to AZP News. AZP News, please give us one brief question. Yeah, we're not hearing
Hi,
you.
good morning again.
Nice.
Minister, I just wanted to go back to the question when I asked about lockdown. What I meant was, and you were correct, I meant about the restrictions, right? So I'm just asking, we have had some restrictions in place for about 6 weeks now, and the cases of COVID-19 seem to still be increasing. is there any thought to reducing those restrictions because, or do you think that they are not being as effective as they should be?
Okay, so prior, once again, the number of cases is not increasing prior. If you look at the figures, as Dr. Hines presented on Saturday, you are seeing the epi curve coming down. And if you don't take my word for it, I will ask Dr. Michelle Trotman to speak to it. So again, the number of cases are not going up. They are in fact coming down. So I will ask Dr. Trotman to speak to that so we could clarify the issue, and I thank you for the opportunity.
Thank you a lot. For us in the clinical setting, what we want is the improved well-being from a health perspective for all citizens. At this moment, COVID-19 is preventing that. So we want measures to try to control that. The measures with the restrictions, we are thankful to the government for allowing what we have suggested to help to control what we saw coming as a spiral increase in cases. I am very, very thankful that the measures that were put in place did not allow that to happen. Because if it had, we could definitely have been in a far worse place than we are now. That's number one. The restrictions, as far as we can see in the clinical environment, is allowing us to see a small but appreciable release and decrease, and I say release for us because of what we face day by day, and decrease in numbers. We need cycles that are 14 days, 28 days, to allow to see how these changes are actually happening. So I know after the first 28 days, we came forward and asked for an additional 28 days that we are now in the middle of with the 6-week period. And we are seeing the difference. With the measures that CMO has taken, we are now able to have at Caura empty wards where they were filled before. And I know that these measures, together with the mask and proper wearing of the mask, which will have to continue even as we make changes, I am asking the public to continue as we have asked, and I'm asking the media to help us, support us with continuing and helping the public, to encourage them to the end of this other 28-day period, where we can look again and see what is needed best for the country and the control of COVID-19.
Thank you very much, and I'm happy to see that Express is back with us and ready to pose questions. So please go ahead and pose your 2 questions. I know we missed you on the first round. Ms. Budram?
Good morning. Thank you. Sorry about that, everyone. A little technical problem. So just quickly, Minister, if you could tell us, with regard to the Chief Justice putting a ban, I'll just use the word ban, on in-person hearings in court, with the exception of domestic violence cases. And I'm sorry if I missed this, the audio was a bit bad.
That's okay.
So there has been a complaint from a couple of judges so far that they were not consulted, the judiciary was not properly consulted on that issue, and it's going to impact their ability to really properly dispense their duties. So I would ask if there was consultation with the ministry, as they're required to be, and was there consultation with yourself, the ministry, the medical authorities, before this decision was made? Also, again, I hope I didn't miss this, I saw a colleague raise an issue about aquatherapy. And so it was just to ask that people who have recovered, are recovering, and may have been sent home, what is there a need to put in place for anyone better access, for instance, to physiotherapy? Because we know the virus can affect the body in a whole host of different ways, and some people may experience, atrophies and that sort of thing. So is there a need at all for that kind of system to be in place? Is it there? do people need the physiotherapy and the added support?
Okay.
Thank you.
So the first question on the Chief Justice, the Honorable Attorney General is really the line ministry that reports to the Cabinet on any matters dealing with the judiciary. If we are asked by the judiciary, by the Chief Justice, or the Honorable Attorney General to provide any guidance, we will provide. But I cannot comment on the rules adopted by the Chief Justice. On the second issue of physiotherapy, I will now ask Dr. Michelle Trotman to tell you what types of physiotherapy are recommended for recovering COVID patients.
Thank you. So our COVID disease, unfortunately, likes the chest area, breathing area. And so patients sometimes can present with bronchitis, which is inflammation and infection of the tubes of the lungs, and sometimes pneumonias and so, that may require additional support apart from medication. If it lies in the realm of physiotherapy, then the doctors would prescribe such physiotherapy and assistance with physiotherapy. Physiotherapy, however, can be quite simple in a lot of these cases that include basic exercises, deep breathing, holding your breath, training your muscles to contract and relax, that you can also do on your own and can be recommended through your doctors with the necessary information. So physiotherapy is needed. If it is needed to be carried out by a physiotherapist, it would be recommended through your physician. Other than that, you can do physical basic measures by using deep breathing exercises and so on in order to do your own physiotherapy if needed.
Thank you very much. And we go now get back to 91.9 for an additional question, please.
I thank you again. Good morning.
Morning.
Just a quick question,
Sure.
Minister, as we continue to have the discussion about moving forward with COVID-19 as part of our life. I mean, we're approaching a year since its emergence in November. And this would mean we'll need to make certain things part of our life. In terms of what we could see coming up in the budget for the Ministry of Health, is there a plan to increase your requests and purchase of things like ventilators and other support mechanisms for respiratory illness in particular?
Okay, thank you for the question. So right now, we have probably about 70 to 80 ventilators currently in the system. At no point in time do I think we have used more than 10 or 15 at any one time. And these facts get lost in the narrative. So right now we are probably oversupplied with ventilators. However, the general question is, moving forward, what will be the demands? And yes, we will make our proposals to the Ministry of Finance, and we will have to, and you don't have to wait much longer. October 5th is right around the corner.
Thank you very much, Minister. And now CNC3, Guardian Media Limited, we're ready for another question from you, please.
All right, morning, Minister. Again,
morning.
I just want to circle back to one of the responses you just gave about the facts pointing towards the last lap at the beaches, which would have accounted for this spike. Now, I think that you will need to do a little bit more explanation into that. And I say that because, and I don't want to sound like a conspiracy theorist, but the election happened just before that period, right? And then when the new criteria restrictions was released, it was a one-day period was given before it came into effect. And the government must have known that this was going to happen, right? So I think we need some more explanation into that, some of the facts that you are alluding to, because I've been a journalist. I was there at the last lap and at elections. And from what I saw, being at those two separate events, the election activities had me more concerned than what I saw at the last lap event.
So again, I will ask Dr. Hines to once again, he will be here on Wednesday, and you can interrogate the bar chart that he will present to your fullest. Okay?
Okay, great. Thank you. And TV6, please. I think we have an additional question.
again for the opportunity. So, Minister, we saw that there had been hundreds of samples returning positive on Friday as well as Saturday. I think Saturday there was 202, I believe. But the reporting period seemed to be over a 2-week period, like 2 weeks prior to Saturday. What does the backlog currently stand at, and why does it still exist?
Okay, thank you. So as I said on Saturday and this morning, there is no current backlog for testing. What we were clearing out up to Friday was that backlog. TPHL's backlog was cleared up, I think, early last week, and the backlog we had to clear up, which we reported on Friday and Saturday to some extent, was that backlog of testing at NCRHA. On Saturday, I was able to report that there were 630 samples in the system to be tested on Saturday, which represented the current number. I did say this morning again that we do have some cases to report. So there is still some reporting to be done as opposed to testing. So Urvashi, thank you for asking the question because it gives me an opportunity to once again clarify it.
Thank you very much. And am I seeing a question from AZP News? Do we have a repeat question? Please go ahead, sir.
Hi, good morning again. Minister, the feed was breaking up a little bit, so please forgive me if I am asking something that has already
That's
been
okay. That's
answered.
okay.
I want to find out about swimming pools. Clubs, for example, who have training, and they practice social distancing, etc. They wanted to know, can they operate normally now? Thanks.
So I will have to go and read over the regulations. For the purposes of controlling and preventing the spread of COVID, it shall be an offense during the period specified in the regulation for any person to be found in any beach, bay, river, stream, pond, spring or similar body of water, including the waters around any island of the coast of Trinidad and Tobago, or any public pool, so I think those are the keywords, any public pool for recreational purposes. So I think it's pretty clear, right? But if it needs further clarification, I will certainly speak to the Attorney General to see if we need to clarify it further to be certainty. Thank you very much.
Thank you, and we still have some time, so we'll take an additional question from I-95.5.
Thank you very much again, Minister Dayal Singh.
Yes,
just
sir.
wanted to find out, as we have you there, the additional testing capacity that was promised for Tobago. Do you have an idea as to how soon it will arrive on island?
Okay. So I don't have a date as yet, but I did note that the Secretary for Health, Wellness and Family Services did indicate, I believe, that Tobago is looking to purchase its own PCR machine. So that's a good development. We are committed when we get in the 160,000 antigen tests from PAHO that Tobago will get more than their fair share so that we could fully decentralize testing across the country, whether it's in Tobago, because Tobago has certain geographical challenges, so Tobago will always get what they need. So as soon as those tests come in, Tobago will benefit from that, and I'm hoping that the Secretary of Health, who I saw made that statement about PCR test machine, that she does in fact get it in the shortest possible space of time.
Thank you very much. And we've come to the end of this morning's press conference. Minister is going to give us just some brief closing remarks before we come to the end.
Video.
Yeah, and then so after we get brief statements from Minister, we will go to the video.
I just want to re-emphasize the simple public health messages, and I am not going to give a statement. I'm going to get the same video we showed on Saturday because this crystallizes it from Dr. Van Kerkhoff.
And so we're going straight to a video that shows us some of the personal responsibilities that we all have to take up if we really are to find strategies to manage COVID-19 successfully and continuously in Trinidad and Tobago. Everyone has a role to play, and we go now to the video. Oh, sorry, I think we're still loading up the video. One of the things that's very, very important is that we all must follow all of the guidelines. We know we see persons wearing their masks, but persons are still standing quite closely together. And so we have to continue, everyone, to do what we need to do. Sometimes we hear persons saying, you tell us to stand apart. What does that mean? 6 feet? It's about the width of a car? The width of a car is about 6 feet distance. So we're seeing pictures in the media with persons with masks. The masks are below their noses. We really encourage everyone. It's very simple. I have a simple mask here. It covers the nose, covers the mouth. And so for some more information on personal responsibility, we are ready to go to the video now.
Everyone on the planet needs to know what role they have to play and to be informed about what this virus is, where this virus is circulating, especially in the areas where you live, the areas where you work, the areas that you want to travel in. All of this is important. There's so much that you can do yourself to protect yourself from getting infected and to prevent yourself from passing the virus on to others. And please make good choices. I know that there are a lot of things that we want to be doing right now, but there aren't necessarily a lot of things that we need to be doing right now. There are many people, essential workers, who cannot stay at home. There are many people who are caring for patients in hospitals who cannot stay at home. And if you can, and if you can help, and if you are asked to, please stay home. You can practice physical distancing from others. You can avoid crowded places. You can avoid enclosed settings that have poor ventilation. You can clean your hands. You can practice respiratory etiquette. You can wear a mask if you cannot do physical distancing. Everyone has a role to play. And this is far from over. So we all have to play our part.